Welcome, this is Alan from World Acupuncture here, and I'll just take a couple of minutes of your time to explain the treatment protocols I used to help a patient of mine some years ago recover from a very severe respiratory condition. I posted about recent treatment for this patient on the forum of worldacupuncture.com, and I was asked to provide a more in-depth description of the treatment and the ailment. So Rob first came to see me in November 2005. At that time he was suffering from severe respiratory distress. He had used all sorts of Western medical protocols in an attempt to resolve the condition, including corticosteroids. None of these protocols had helped his condition at all. In fact, his condition was worsening, and he felt, in his own words at that time, that his life was slipping away. So his condition was dire, to say the least, and his ability to inspire air was greatly compromised. So in the diagnostic procedure, when I first when Rob first consulted me, I deduced that this particular problem, this respiratory problem, whilst it occurred in the lung, the fundamental cause of the respiratory problem was in fact kidney deficiency. There was an inability of the body to capture the ki, or the Zen ki, that he was taking in and sink it down and utilize it to its fullest advantage. So in fact he was only getting in a third to a half of a lungful of air every time he breathed. So initially I started treatment in November 2005 using a lung deficiency root treatment. That's lung 5, the water point, on the metal meridian, and kidney 7, which is the metal point on the water meridian. So it's a nice balance there, where we were both using the lung meridian to tonify the kidney and help reconnect the kidney and lung synchronicity. And of course we were using the metal point, or the representative of the lung, on the water meridian or kidney meridian, in using the point Fulu, kidney 7. Also subsidised that treatment with what we call a shunt on the stomach 36. For various reasons on the pulse, it seemed to be a complementary way of going about things. So this was a very serious situation. The gentleman was he was very, very concerned that he in fact was dying. So over the next 6 months I administered 25 treatments to Rob. The major variation occurred probably after about 2 months of treatment, where the edema, there was some pitting edema occurring in Rob's ankles that was causing concern, and also another quite marked signature of kidney deficiency. So we transferred from using lung 5, kidney 7, actually moved to using Ondan, or needlehead moxa, if you like. It's an odorless form of needlehead moxa from Japan, with a charcoal base that fits in a wire basket on top of the needle. We applied the Ondan moxibustion as a root treatment to lung 5, and I changed the kidney point to kidney 8, having been advised by Masakazu Ikeda Sensei that this indeed was a brilliant point for resolving pitting edema, and it helped strengthen the kidney energy no end. So utilising that change format of treatment, we continued working with the respiratory problem. At the same time we were able to address the pitting edema more specifically in his ankle area. Very pleased to say that after 6 months of treatment, Rob had recovered to full health, which was terrific news for him, and it was a wonderful fillip for myself as a practitioner. It's great to be able to be of service in such a way. Late last year, 2010, Rob came in again. He owns a farm in northern New South Wales here in Australia, and he had been stripping out the kitchen and found himself in a very compromised immune situation, where he was getting sick regularly. So upon investigating the condition, I found that there was a variation at this time in the latter types of treatment, where I moved from the original kidney deficiency root treatment in 2005. Please keep in mind that it had been some years since I had seen him, and it became apparent that spleen root treatment was going to be the most effective form of root treatment to help Rob to resolve the condition that he presented to me in late last year. I'm pleased to say that after several treatments, I'm just going here, I used the spleen root treatment using the metal point of the pericardium meridian, pericardium 5, and the metal point of the spleen meridian, spleen 5, and I shunted the left point of the lung meridian, lung 6. Obviously the pericardium 5 and spleen 5 used to tonify the spleen meridian, with some influence on the lung meridian, as they were metal points, and also used the lung 6 to resolve some of the congestion that was very, very apparent, and through his pulse and through his actual physical condition. So we had, excuse me, so I treated Rob in this case, and you'll have to apologise for the delay there. I treated him specifically with spleen deficiency for 1, 2, I think 5 treatments, and he found himself feeling stronger, better. He was not getting sick regularly. The congestion on his lungs settled down. I also advised him to wear a mask when he was doing the renovating on his kitchen, because of the particles that were getting into his lungs as a result of the tearing down walls, etc. Very pleased to report yet again that after several treatments, Rob recovered full health again, and he has now committed himself to coming in once a month for regular preventative treatment, so that he's not continually turning up to clinic in dire health circumstances and asking me to rescue him. And that has worked out quite well. He has maintained good health right over the Christmas period. He's been able to continue with the renovations on his property, and I'm very pleased to say some 5 years after first seeing Rob, his health is in very good condition, and on both occasions that he's come in with severe respiratory problems, I've been able to assist him using Japanese acupuncture. On the first occasion, as I've said, with the kidney deficiency root treatment, and on the second occasion, that was in 2005-06, and then in this occasion, it was in fact slightly different condition. His body was in a different condition, so the spleen root treatment proved to be extremely effective. So for Chris, who asked the question on the forum of worldacupuncture.com, mate, I hope that this provides a satisfactory answer for you. For other viewers who have been watching and listening to what I've got to say, I hope it's of some benefit to you in clinic, and that you too are able to procure some distinctly positive results and clinical outcomes for your patients. And all the best for 2011. This is Alan Jansen from worldacupuncture.com saying see you later. Thanks for viewing.